Afternoon, students. Today we are going to see the what are the factors affecting the absorption. These are the total 12 factors will affect the absorption of the drug. Either they will increase the drug absorption or they decrease the drug absorption. Routes of drug administration, lipid solubility, pore size, molecular weight, pH, food, drug, other substances, gastric juice, gastrointestinal diseases, presence of carrier or transporter, dosage form, blood flow, pharmaceutical factors, and genetic factors. In these routes of drug administration, lipid solubility, pH, and food or drug other substances present, genetic influence are the very important factors. Now we are going to see the individual factors in detail. Then routes of drug administration always oral route will have the slow absorption compared to the parenteral route. Whatever drug we administer parenteral routes will have faster drug absorption. That's why these routes are preferred in the acute and emergency conditions. Lipid solubility, lipid soluble drugs will absorb faster than water soluble drugs because our body is made up of with lipid layers. That's why they will dissolve very fast and absorb faster. Then pore size, big molecular size or big size drug molecule of big size, they absorb very slow because pore size will be very small, or ion channels all will be having small size. Then it will that big size molecule should undergo dissolution and disintegration, then only it can absorb. Then small molecular size will absorb very fast. That is depending upon the size of the pore. Then molecular weight, low molecular weight will absorb faster and high molecular weight will absorb slow because low molecular weight molecules will have the smaller size, they can easily pass through the pores. Then high molecular weight will have the big size, that's why they won't absorb faster. Here negative in the charge of the molecule also will have the difference. The negative charge will absorb faster than positive charge. Then pH is the very important thing in the absorption because depending upon the environment, that means depending upon the where drug molecule is present around that molecule, what pH is there, that will decide either drug should absorb or not. These four things you should remember very well. Here simple is drug molecule will absorb when it is there in the unionized state. Whenever you administer any drug, if it is there in unionized state, it will absorb. But unionization will be depending upon the drug pH as well as surrounding pH. For example, if you see acidic drug enter into the acidic area in the body, then it become unionized, it will absorb faster. But same drug, same acidic drug enter into the basic area, it become basic environment, then it will become it become ionized, then it will be slow absorb or it won't absorb. Then same vice versa for the basic drug. Basic drug enter into the basic area, become unionized, and it will absorb faster. Then basic drug enter into the acidic area, then become ionized, slow absorption. Here simple is what type of drug you are giving and what area, which area it is going inside the body. That will decide either drug should undergo ionized or should unionize. Okay. Now this is very little bit will be confusing. I will explain along with the drug. One example, for example, if we see aspirin is a acid, it's simple as acetyl salicylic acid, aspirin name, then it is a acid nature. Then this aspirin, if you give oral route, it will enter into the stomach will have the acidic pH. Now here drug is acidic and stomach pH also acidic. When this aspirin enter into the stomach, acidic drug enter into the acidic environment, become unionized, then it will absorb faster, it will absorb or it will cross the stomach layers very fast. Thus, once it is cross the stomach layer, when it is enter into the cell will have the basic. That means aspirin is acidic nature, but in the cell will have the basic nature. That's why it will become ionized, then it will trap inside the cell. That's why, and the same way this aspirin comes down. That is from stomach it is come to the small intestine. What will happen? Small intestine will have the basic environment. Then drug is acidic. Then aspirin, acidic drug enter into the basic environment, become ionized, then it will absorb slow. That's why that is the difference. If you give the acidic drugs, will absorb faster from the stomach and slow from the intestine. Same opposite direction. If you administer any basic drug, will absorb slow from the stomach, faster from the intestine. That's a simple way of telling things. It's here is what is the nature of drug and what is the environment. That will decide either drug should absorb or not. You maybe studied ion trapping. That is the one of the thing. Once we go to the aspirin chapter, I will explain what is the ion trapping. Now here another thing is, if any person poisonized by acidic drug, then if drug is filtered in the urine, you make urine become uh, basic. Then what will happen? Acidic drug will filter into the basic urine, become ionized. Then it won't reabsorb from the bladder. Then it will excrete. That is one of the approach in the treatment of acidic drug poison. That we example is a phenobarbital, because phenobarbital is derived from barbitric acid. Then that's why it's acidic nature. Then we make the urine alkaline. It become ionized. It won't absorb. That's a very very important thing. And this area is the way all students should understand thing. Here I repeat again: acidic drug, acidic area become unionized, absorb faster. Acidic drug, basic area ionized, it won't absorb, or either it will absorb slowly. That's the thing. Very very important thing you should remember. And when you are writing factors affecting drug absorption, pH is the one of the important thing they looks. Okay. Then come to the food, drug, other substances. Here, if you see the after food, if you are taking some drugs after food, it will increase the absorption. Some drugs will decrease. For example, if you see propranolol, if you take after food, it absorption will be increased. But same thing, rifamycin, if you take, absorption will be reduced. Then fatty food will increase the absorption of glycophyllin. Then along the milk, if you take tetracycline, they become complex, because milk contains the calcium. Tetracyclines will react with that, then it won't absorb, either it will absorb slow. Same way, if you take the iron along with the juices, any acidic juices like grape juice or lemon juice, then absorption will be increased, because iron conversion will be more in the acidic environment. Like that, food and what we consume, other drugs will decide the thing. For example, if you see, you take iron with the antacids, iron absorption will reduce, because antacids will reduce the pH. When pH is reduced, automatically iron conversion will be reduced. That's a very very important thing. Next, gastric juice, acidic drug faster absorption, basic drug slow absorption. This, as I already told you, acidic drugs will convert it into unionized form, they will absorb faster. Basic drug, the reverse way. Then some of the protein nature drugs will be destroyed by the gastric juice. For example, insulin, penicillin G. They are all made up of with the proteins. When you administer orally, they will be destroyed by gastric, HCl or proteolytic enzymes. That's why that drug should not be given by the oral route. Then gastrointestinal diseases. For example, Fasana celiac diseases. Amoxicillin absorption will be reduced, but cephalexin absorption will be increased. If any person has celiac disease, if you want to give any antibiotic, you should see in this condition either drug will absorb faster or slow, because drug absorbs slow, effect disease will be progress. If drug absorb more, then it will cause the toxicity. That's why you should be very careful while administering the drug in the celiac diseases. Then intestinal mucosal enzyme, they will destroy the penicillin G. That's one of the metabolism. That's why there won't be any absorption. Then dosage form, as simple liquid dosage form will absorb very faster, followed by semi-solid, and last is the solid. Then blood flow, high blood flow will absorb faster the drug, low blood flow will be slow, because high blood flow will remove the whatever drug absorbed in the thing. That's why concentration gradient will be always will be maintained high and low. That's why absorption of the drug will be very fast. Then pharmaceutical factor. Here we see the disintegration and dissolution. What is disintegration? Disintegration, one big molecule has to convert it into small molecule. That is called as a disintegration. What is dissolution? This small molecule should convert it into liquid form. That's called disintegration and dissolution. If this time is very less, drug molecule, if we give it as low disintegration and dissolution rate, and absorption will be faster. Same disintegration and dissolution will be very long time, it will be absorbed slow. Then genetic influence. Genetic influence is the one of the important thing in the pharmacology, that comes under pharmacogenetics or pharmacogenomics. Here thing is, what is the effect of drugs in relation to the presence of genes. Some people will have the, for example, if you see isoniazid, normally isoniazid will be metabolized by acetylation, that is acetyl transferase enzyme. In normal person who have normal acetylation process, if you give the isoniazid, there won't be any problem. But if some people will have the slow acetylation, fast acetylation. If you give in that condition, person, if you give isoniazide, either absorption will be increased or decreased. If you give isoniazide in the fast acetylators, it will metabolize fast, it will absorb slow. It absorb very it don't have time to absorb. Then there will be therapeutic failure. Like that same way, pseudocholinesterases. Normally, succinylcholine will be metabolized by cholinesterases. If it is pseudocholinesterases is there, succinylcholine will not be metabolized. Like that, some genetic relation also will decide the drug absorption. That is related to the drugs affecting the absorption. I have told 12. In this, at least you should remember 5. Now, question will come 5 to 6. You have to write in the exam. It's a very important short notes. What are things I can write? First, what thing they will expect in the exam is genetic influence, gastrointestinal diseases, gastric juice, food, drug, other substances, then pH, route of administration, lipid solubility. These are the major things they look in the answer sheet. Other all you can write it well and good, but at least these 6 to 7 you should write it very well with the exam. Okay, with the exam. Then if you like my videos, please subscribe and share with your friends. Thank you. And next we will see the other short notes questions. Thank you. Please subscribe my channel.